Hi there, I'm Bree. I'm going to teach you guys how to do an injection for your peptides. So first you want to get all your supplies out, your peptide, some alcohol wipes, and your syringe. There will be an orange cap. I've already pulled mine off at the end of your syringe. You can just toss that aside. So the first thing you'll do, if it's a brand new bottle and you haven't opened it yet, well, I guess it'll already be reconstituted, so the cap will be off. Every time you get into your peptide vial, you want to clean it off with alcohol. The vials are self-sealing, so you don't have to worry about a hole, you know, like stuff pouring out of the hole or anything. So just scrub that off with alcohol. And then you're going to get your syringe out. You will just take your cap off. There is a small circle in the middle of that kind of rubber stopper, and that's what you're aiming for when you put your needle into the vial. So you turn the vial upside down and hold your needle like this, and then you just puncture the vial with the needle. These needles are really bendy. They're super fine, so just be careful. And then you're just going to pull back on the plunger to the desired amount. This one says 4 units, but everybody's stuff is different. Each tick mark on these syringes is a unit. So obviously they're labeled in 5s, but each little one is 1 unit. So this one just says to go to 4. So then when you've pulled out your, I just have a little bit of saline in mine because I'm not going to inject this actual peptide. So when you've got your desired amount, you just hold the shaft, not the plunger, hold the shaft of the syringe and then pull off the vial. And then just shut your vial down. You're done with that. And then you're going to get alcohol. You can use the same alcohol swab or a new one. You always want to inject in your abdomen. Avoid the belly button area by about 1 inch or 2 in all directions. Your belly button is mostly connective tissue, so it will burn a little bit more, but also it doesn't absorb as well in that area. So, and then each time you inject, make sure you're moving your sites around. You don't want to go in the same exact spot every time, as it will just get really sore and bruised and whatever. So just make sure you're moving your sites around. So when you go to inject, pick a spot, clean it off with the alcohol, and then pinch, okay? Just pinch the skin. You're not going into the muscle, so you're just pinching that subcutaneous layer of skin and that fat underneath the skin. And then when you inject, you want to go in at about a 45-degree angle, so you just poke your skin, and then you touch the plunger, okay? And then you will just push down on the plunger like that, pull out the whole needle. You shouldn't have any bleeding. We don't have any major vessels under the skin in our abdomen area, but we do have tiny little capillaries. So if you have a little tiny drop of blood or something that comes out, that's what that's about. And you can put a Band-Aid on it if you want, but it should stop relatively quickly. But you probably won't get any bleeding at all. So if you guys have any questions, let us know. Otherwise, happy injecting.